Hello, my name is Eric Bricker and I'm the Chief Medical Officer of Compass Professional Health Services. I'm a general internist, primary care physician, did my training at Johns Hopkins Hospital in Baltimore, Maryland. And Compass is a healthcare cost containment firm that provides tools and support for healthcare consumers through a centralized personal healthcare concierge, which we call a Health Pro, that provides in-network price transparency, problem bill resolution. We find a lot of physicians for our members. We also close gaps in care and get members steered to what we call centers of value or centers of excellence for specific specialty care as well. And so today we're going to talk about best practices with employee engagement. Employee engagement is all the buzz these days because obviously if we want to change the way employees and their family members interact with healthcare services, then we need to engage them and have behavior change. And so in working with we have over 1,200 customers and hundreds of thousands of employee lives that we support, and a lot of major blue chip corporations, whether it be a major US airline or a logistics firm. We have multi-billion-dollar retailers that are clients of ours, and we've been supporting clients since the summer of 2007. And so over the course of that, going on 6 years, we've really learned a lot about employee engagement. And so there's sort of two big best practices that we have learned in regards to employee engagement. Sort of the first best practice is around interruption, or just getting people's attention, right? People are so busy that it's oftentimes hard to get their attention. And so really one of the sort of the fathers of getting folks' attention is a gentleman by the name of Seth Godin, who wrote a book called Permission Marketing, and sort of best practices around getting people's attention and having an attention asset is what he calls it, is in regards to, one, delivering information that is personable and relevant and timely for that individual, and also to have that information be dripped over time and not just sort of, fire hose approach. So you want to think more garden hose as opposed to fire hose when you're providing that information. So what does that look like for an employer? That means that messages need to be tailored for the specific employee. They need to be repetitive. They need to be, whether it's every week or every month, maybe every 2 weeks. They need to be delivered in different formats. So do they need to be delivered hard copy, by email, by company intranet, by video, maybe by telephonic voicemail? And so we've really found that using those different approaches is actually a good strategy. You actually don't want to use one. You actually want to use different approaches, different ways for different people. And what you'll also learn during that sort of drip campaign is to be very iterative. In other words, you learn a lot for what works with certain people versus other people. And so you need to measure during that drip campaign. And so then you apply that measurement to iterate your processes, okay? So those best practices from Seth Godin have really taught us a lot about how best to interrupt or get the attention of employees and their family members, okay? So once you've gotten their attention, the second important piece around employee engagement is then the behavior modification, okay? So you've gotten their attention, but now they need to change the way they think or the way that they act in a certain way. And behavior modification can be thought of in terms of what's referred to as the force field analysis. Okay, and a force field analysis means that when you're changing any sort of status quo or behavior, that there are forces for and there are forces against. And so the forces for behavior change might be an incentive program, whether it's gift cards, or it could be an incentive program in the form of value-based plan design, where there might be a premium differential for a certain behavior, like using your Compass Health Pro, or it could be differing levels of coinsurance or deductible based upon whether or not the member uses their Compass Health Pro. So those are those forces for. Just having a consumer-directed health plan and having more out-of-pocket cost and needing to be a better consumer or steward with that out-of-pocket cost, that's also a force for that behavior change in terms of being a more informed healthcare consumer and really engaging in things like price transparency tools for consumerism. But then there are forces against, okay? So it's like pushing down on the gas is the forces for, but then you also need to let up on the brake in regards to the forces against. And so those forces against are things like, well, one, just time, right? People don't have a lot of time to be a healthcare consumer. Another force against would be just skill. I don't know how to be a healthcare consumer. You have to teach me how to do that. I have no idea how to be a healthcare consumer. Another force against might just be tradition or maybe just intimidation. Well, the tradition is I just kind of do whatever my doctor says or maybe I just feel intimidated talking to my physician, where actually having a dialogue back and forth with a physician in terms of shared decision making actually will probably end up having better outcomes for you, and actually having you get better care that's sort of more relevant and more personalized for you. And so when you're dealing with the behavior modification, you have to have those forces for, whether it is putting a consumer-directed health plan or value-based plan design or an incentive program such as gift cards. But then you also, that's part of what we do as part of our healthcare advocacy concierge service, is to remove those barriers that are the forces against, in terms of actually being able to do things for the employee, removing that time barrier, actually knowing how to speak to doctors' offices and hospitals so people don't feel intimidated about doing those things, actually educating consumers around how it is to, what kind of skills do you need to actually be a healthcare consumer, and being sort of their coach or side-by-side guide when it comes to navigating the healthcare system. So those are some things that we've really learned in terms of driving engagement with employees. Really appreciate the opportunity to share those with you today. If you'd like to read more about employee engagement, we have multiple posts on our Compass blog about that. And so thank you so much for watching. Hope you have a great rest of your day.